morning. My name's Gordon Cooper. I own and ran a medical practice for 5 years. We recently sold that, and in the time that we owned that medical practice and did consulting to other medical practices, we developed a system called Appointuit, which was all about business process and how to improve that, and how to improve those thin margins that you have in medical practice. So today I'm not talking so much about Appointuit. I'll just go through different things, but what we go through here is that there's tools and processes and systems within Appointuit that can help you manage certain parts of it. So, why is the business of healthcare management important for all of us? Because we're in the healthcare business, and so for a long time a lot of people probably just, as Paul said, people didn't know the value of their practice. They just, the doctors have a vocation of being general practice or surgeons or whatever they may be, specialists, but they don't realise they're in the healthcare business. So you've got competition is increasing, you've got government funding is decreasing, obviously your Medicare rebates, and neither you or the doctors are likely to take a pay cut to cover the shortfalls. So what can we do about that? Well, we could continue on making significant changes to the business. So we'd say, well, we need to improve next year, so our easiest solution, or our easiest first thought might be, let's get another doctor, let's get 2 more doctors, or things like that. But that's not easy. Who's tried to recruit doctors? Not an easy task, and it takes some time. And you could take you 6 months, and you might find the wrong doctor, and you have to get another one. So that's not the best way to go. It's not realistic, and you can't trim costs, because if you keep trimming costs and you keep trimming staff, you just keep trimming your service. And so you just keep getting down into a downward spiral. So what we could do, and I think in one of Paul's slides, we change our business approach. So incremental improvements in your business. So just look at how could we do a few small changes in the business. Where would we start? At the first step. So you only climb the staircase one step at a time. Don't look at the big goal, that's the mountain. It's usually unachievable. So you just take one step at a time. So you start with a simple model for improvement and find the right tools. If I asked you if you could improve your medical practice bottom line by 50% or more, would you feel confident about doing that this year? But if I asked you to, could you find 3 or 4 key areas in your medical practice or in your specialist group that you might be able to just, let's make little improvements on each of those 3 or 4 or 5 areas. Does that sound a bit easier? Okay, so I'll just jump out of that. So if we understand that we've got that approach, I'll show you what I've used for a long time, and I'm not an accountant, so let's just jump over here. This is really just for demonstrative purposes. So if we looked at, just say for example, we have a practice that had 7,000 inquiries throughout the year. That could be people phoning up your practice, people walking in, they want to come to your medical practice and things like that. And so if you had a 60%, so if you look at it from a business metric, if you had conversion rate of 60% of that, so people who rang up your practice, the 7,000 that inquired, and you got 60% of them making an appointment with your practice or booking in for your services. So realistically, you might have 4,200, sorry, it's a bit blurry, 4,200 patients for that year for that practice, right? If you had an average bill, so if you knew your metrics, if you had an average fee of $50, and each patient visited on average 3 times a year, and we know that on average in Medicare it's around about 5.5 or 6.5, so that wouldn't be too hard to achieve. Just a simple multiplication down here, number of patients by the average bill, by the average visit, 630,000. 90% of your revenue would go to cost, so that's your doctors, rent, staffing, marketing, operational costs. So you have about 567,000 in this example. Oops. And you have a 10% return on your practice investment. So a simple, easy explanation there. And then what if we didn't try to tackle the mountain? What if we just tried to say, let's have a couple of improvements. What if we just improved our conversion rate of our inquiries to our patient appointments by just 5% on what we previously had? So going from 60% conversion to 63% conversion. And that could be something as simple as Paul said, training. Maybe training your reception staff better to convert patients to better appointment management. It could be Who has an online appointment system anywhere in their practice? Yep. So you're now open 24 hours for appointments, right? So the practices in the room who open up from 8 a.m. till 5 or 6 p.m, you're limiting your possibility. If you simply had online appointment system, whether it was our system or another system, do you think you could probably get 3 or 4 appointments while you're sleeping? Easy improvement there. So a couple of things, better access. You know, who's a general practice here? Yeah. And we own a general practice. And you know what annoyed me so much is that when we closed our practice every night, we had a big sticker on the front door that said, if we're closed, go off to the after-hours service and ring someone else. I'm diverting my services to somebody else. Or I'm diverting my services to the practice that is open till midnight. So now, in our practice, we didn't do that. We diverted our customers, our patients, to our online appointment system, unless it was an emergency. But if it's not an emergency, why can't they just book at 8 or 9 o'clock at night for the next day? Online. Excellent. I'm not going to talk flash. There we go. So what if we improved lifted our average bill by just 5% on the $50 up to $2.50? How can you do that? You can engage with your patients, as Paul said before. We've got in general, and I talk mostly about general practice, but we do have specialists and allied health using our system as well. But in March, for example, is flu vaccination season. Now you can manage your flu vaccinations from March through to September, ad hoc, see what happens when they come in. Or you can engage with your patients through use of technology, and you get most of your flu vaccination patients coming in between March and April. So you get a higher lift of revenue in March, April, and then between May, June, July, August, you've now got capacity for higher healthcare services. So that's what we did at our practice. We pushed them all across into March, April. You can better manage flu vaccination. What about when it's men's health or November, breast cancer awareness? Department of Health and Ageing has a monthly calendar of all these events for preventative healthcare. It's covered under, in practices, you have to do preventative healthcare promotion under RACGP standard 1.3.1. So you can do that nice and easily. All these things would help lift the number of patients that you might have, might lift the value of the services that you have. What if you can increase just by 5% the repeat visits of the practices, of the patients? So that's the same sort of things in the engagement with the patients. So if I come in with a sore knee today, why don't, even if you didn't use technology, you need to remind, your team needs to remind me to come back in March for my flu vaccination. So even if you didn't use the technology, you can still lift up your patient numbers. What if we decreased the operational costs of the practice? Because that's hard. We're not going to take a pay cut, so we have to decrease the operational costs. So if we did all this engagement, some people might think, well, that's going to cost us a fortune. I'm going to have to employ staff. I'm going to have to employ nursing, admin. That's going to take them away from doing their proper job. I'm going to have more postage. Use technology. Do it electronically. We have practices who send out, there's a practice here in Brisbane, last week, 31,000 emails they send out to their patients. And they have a high open rate, and they can see that if they do this campaign about a particular subject or health matter, they can see in our reports on our screens that they got a 45% open rate on that email. Then they can see how many patients actually made an appointment from that email directly back to their practice. So they can plan, do, study, act, they can do measures. They can see, well, that campaign worked, so if that works, I'll do more of that. And you'll get a higher uplift. So if you do just those 5%, those 3 or 4, what's it, 1, 2, 3, 4 aspects of your business, and you increase it by 5%, you end up with about $105,000 of your net profit. So you've got a $42,000 increase, which is around about 68% increase on your bottom line. So I'm not, like I said, I'm not an accountant, but it just illustrates that if you make small incremental changes across various parts of your business, it's not that hard to get that big improvement. That's what we did with our practice at St. Lucia, and we just focused on that. Jump back in here. That one. Oops. So we need to use the right tools for improvement. Online appointments, we spoke about online appointments a little bit, and patient engagement. What's the difference? So you could do ad hoc, find a doctor, marketplace. That's going to cost you money. It's also going to put you in, imagine like Yellow Pages. So there are some out there that are just really like Yellow Pages rebranded. If I type in doctor postcode 4000, I'm going to be up against a list of 20, 30, 40 doctors. So I'm putting myself in the meat market. And as a practice, you want continuity of care. You want to have your patient-doctor relationship. If you look at your patients as customers, Business 101, look after the existing customers, the existing patients that you have now, rather than keep chasing new ones. It's much easier to look after the customers you have now. Dr. Sheldon Cooper doesn't like that idea. He doesn't like the marketplace. So what if you had business processes, sorry if that's a little bit too small. If you had business process as a service, it improves the process. So imagine if you could improve the reminders and recalls process of your nurses, your doctors, things like that. If you could have some of your scripts that were requested online, instead of having people leave, like imagine you're leaving work, city, going out to the suburban practice, you have to waste an hour all for a 5-minute script. Why not do it online, charge the customer for it, the patient for it, it's higher value services. It creates and manages appointment yield. So the practices that use our system for appointment engage, when they have, for example, flu vaccination season, when they send out that email and or SMS, however they want to do it, they can make it so that the patients can book directly from that communication, email or SMS, and it books them into let's say a 9 to 11 time slot on Tuesdays and Thursdays. So now you're looking at resource allocation. So if you've got a nurse who might work from 9 o'clock to 2 o'clock, sometimes they do work for school hours or part-time, you don't want vaccination appointments coming in at 4 o'clock in the afternoon. One, it's not very good medically because in case they have an adverse reaction. But two, you want to cluster similar type of appointments together so you get better efficiencies. So you could look at, we've got a doctor, as Paul was saying, you might have a doctor who sees 22 appointments a day. If you got more efficiencies in your practice and you had clustered appointments into the right area, maybe you could move that doctor up from 22 appointments a day to 23 appointments a day. At an average fee of $50, $50 extra revenue every day, just by a simple rework of how your processes are. Reducing the cost of operations and improves my practice satisfaction. So we get patients who ring us up, and practices sometimes, they ring us up after they made an online booking to tell us they've made it because they're excited. Kind of defeats it. We also get some complaints, but we handle those. All right. So this doctor is happy with that process. So you've got to, for each practice it's different. So you've got to know what you want from your system, from whatever system you choose. And we'd like you to choose our system, but if you don't, that's might be better for your practice different there. You've got to understand your doctor-patient relationship. Why do people come to your practice? So they usually come because the doctor has a reputation of credibility, word of mouth referral, they've asked people in the neighbourhood, things like that. And quality service, and they trust you. So don't forget, these people, patients, are at some stage going to be standing probably naked in front of the doctor. So it's not something you want to just Google search, pick a doctor by postcode, and hey, I'm fine with that. Some people that's okay, but you want a doctor-patient relationship. Understand your practice and your patients. Paul touched on this. So your new patient, your patient profiles. If you understand that your patient base, you may well have some people over 65 or over 75, and they may not use technology, but that might be 10% of your patient database. So are you going to stay in the processes that you currently have, traditional processes, because 10% of your patients don't use technology, or are you going to address the other 90% that may well improve? So it's not one or the other. The people who don't use technology, they can still ring up, that's okay, but at least they can get through this time because you've got online appointments or patient management and your phones aren't so crowded. What are the pain points you're trying to solve? So understanding your business, don't just jump in and say, oh, it'd be great if we had this or we had that, if it doesn't actually revert back or trace back to what business improvement you're trying to do. How do your patients engage with your practice right now? So if you understand some of those things, you'll better get those improvements in those different areas, and you'll get the right system. So who's been sold or who's been offered online appointment systems that, hey, look, we can give you a nice fancy app and things like that. We can do your website, those sorts of things. Is that on your feedback form, on any of your patient feedback form? Hey, I love this doc, they've got a really fancy website and great SEO. Yes, it's important, but that's not what you go to a doctor for. And there are ways to do that. The best way to do that, to start with that, is if you understand your medical practice, I'll bet you all make sure that your reception is very clean, respectful, nice, neat and tidy. Yeah? So do you do the same attention to your website? Because isn't that your virtual front door? Isn't that your virtual reception? So why don't you tidy up or review your website once a quarter, once every 6 months, see what's different. That's your virtual front door, that's your virtual reception. It needs to tidy up and clean every now and then as well. That's it. Okay. So I rushed through it, but that's my point is that you really have to understand what your business is before you go and choose a appointment management or a patient engagement system. Our system is different from an online appointment system. It is a business process as a service. So I just had a doctor ring me up just before this presentation, and they said, oh, Uber is getting popular. And no, they didn't want Uber Doctor, but you know what they wanted? They understood their customer base, and they said, Uber has to get a lot of medicals done for all their drivers. We want that business. How do we do that? Through Appointuit. So they're going to get, you know, like we've all gone through the phases of mining medicals and pre-employment medicals. They're right under it. How do I get that Uber? How do I ride that on the coattails of Uber? There's a lot of Uber drivers out there. They're going to be paying whatever it is for their Uber medicals. Jump on it and do it. So they'll have an appointment called Uber Medicals. We can do all that sort of stuff.
Can I ask a question? Sorry.
Sure.
This is very much for a general practice, correct? Because the specialist practice, looking online, you get referrals. So a patient comes to my home and saying, actually, I'm fancy going to see my oncologist or an eye doctor because he or she needs a referral before they can actually make the appointment.
Yeah.
And then the specialists want to know what is actually wrong with you before you just look up. How does it work for the specialists?
Yeah, so correct. So for the specialist, they need the referral, they need some pre-appointment information filled out, some forms filled out, and certain requirements, policies, and procedures. I can go through in detail with you outside of this presentation, but yeah, we have a lot of specialists who do that now, and our system can navigate the patient to make sure they've got their referral letter. They can, in the policy procedures, it will direct them to the forms that they need to download and complete before they come to the specialist practice. All their informed financial consent can be included in there as well. So before they turn up to the specialist practice, they will be well guided to making sure that they've got their referral letter, that they've got their medical insurance or their appropriate medical insurance details, that they've got the policy procedures of that specialist practice. So each one of those, we do a lot of customisation. So our system has a lot of things that you can turn on and off for different things. So we've got specialist groups, we've got multi-group, GP specialists, allied health, all using our system.